Okay, welcome back to our annual Medicare seminar with Laura Shriver. Thank you very much for helping us out today and giving us a lot of updates to the new 2026 Medicare world, which is rapidly changing by the day, it feels like and seems like. And we've been fielding a lot of questions, so it's a perfect time of year that we have this seminar. So, as a quick disclosure, everything that we mentioned here is for informational purposes. Neither of us work for insurance companies. We're not here to promote any one insurance company. We're just here to provide you information to make an educated decision. So, that's as short of disclosure as I can make. So, with that, we got a visitor.
I'm sorry.
So, that's
I'm working
okay.
from home today.
Yeah, no problem. So I'm going to turn it over to you and give a little background, and then we'll jump right in.
Sure. So I started working with Jeff in insurance about 18 years ago. And I always, from the very beginning, found it very interesting, the needs of seniors and people with disabilities, even way back when I worked with Jeff. So, I ended up really gravitating towards that particular group of people and have now become an expert, exclusively working with those people for the past decade, a little bit more than a decade. So, as a Medicare broker, what that means is I can offer almost any single plan in the county that you live in. And also, what that means is not only do I have my federal license, but I also have my state license. And I also have a special license with the county. If there's time at the end for me to talk about that, I'll talk about what that means. But I do want to just, let you know that I can take care of any senior, whether you're 64, turning 65, and wondering, how do I get Medicare? Or maybe you're in your 90s and you're starting to slow down a little bit and you're wondering, how can I get affordable home care because Medicare doesn't cover that? So I have cover the whole gamut. So with that being said, since I have the ability to share my screen, I will go ahead and share with you the Medicare basics, which I am happy to share. And I'm not sure, what kind of crowd we have on here today. So give me one moment here. I'm going to go ahead and share my screen. And as I said, as a broker, I represent multiple carriers. So don't let United Healthcare fool you. They just happen to have a really good Medicare basics presentation. So I'm just going to go through this with you because sometimes having a graphic organizer is helpful. Prior to being a insurance broker, I was actually a school teacher by trade. So I really do enjoy taking complicated things and really breaking it down into simple forms. And so, what Medicare is a federal program for those of you who might be 64 or in your early 60s watching. You have to work 40 quarters, and Medicare is provided to you by the federal government. Part A is hospitalization, and Part B is your doctors, hospitals, and things of that nature. So you must have lived in the United States for 5 years in a row before applying. And you have to be disabled. My husband happens to have Medicare, even though he's only 43. So if you know someone on workman's compensation or disability, after 2 years, they actually also qualify for Medicare. So, as I said, Part A is going to cover your inpatient hospital, skilled nursing, and Part B covers your outpatient care, doctors, imaging, things of that nature. And then Part D covers your prescription drug coverage. Now, there's two different strategies that you can take depending on your comfort level. I told you I used to be a school teacher. So, one of the things I would talk about a lot is personality types. So, some personality types, like my husband, they prefer things to be, steady, and he doesn't care about paying more money to have the best coverage. And when I say best, I say that loosely because it really depends on your personality. But a Medicare supplement is something that you can purchase. It'll be anywhere from $300 to $800 a month. And that Medigap plan will cover all of your out-of-pocket expenses not covered by original Medicare. So original Medicare covers 80%. And then that supplement plan G would cover the rest. So this way, no matter if you were hospitalized anywhere in the country, any doctor, there's no network and there's no out-of-pocket cost to you other than the cost of the insurance premium. And then there is a Part B deductible. What I'm going to focus on today is Part C. And the reason for that is because Part C is A, B, and D all together under one roof. And the government labels that Part C. And Part C is interesting because everyone is going to get charged a certain premium from the government. So that cost covers Part C. So you don't actually have to pay anything in addition, like you would with a supplement where you're paying hundreds of dollars a month. You actually get Part C as part of what you're paying the government for. They usually take it right out of your Social Security check. If you're not collecting Social Security yet, then they'll send you a quarterly bill. And so that covers your premium for Part C. So oftentimes you can get Part C coverage for $0 or for a very, very modest premium. And so Part C puts A, B, and D all under one roof, and it's managed by a carrier. We'll say a United Healthcare, a Humana, Aetna. There's dozens of companies out there. And so you have some options where you can either keep original Medicare and get Part D like David, so you have some prescription drug costs. If you know someone in their early 60s, it's very important for you to know that if you do not get Part D right from the very beginning, you're going to have a lifelong penalty. So it's a big no-no not to take Part D. Sometimes people make that mistake. Don't make that mistake. You also want to take Part B like boy. Even if you're a veteran, they still encourage you to do this because you want to have that extra coverage. And Part B is also something that you need to sign up for right from the very beginning. You have until 3 months after your 65th birthday to get all of this in order, so you don't get a lifelong penalty. So that's really important. So you want to have at least parts A, B, and D. And then you have the choice if you want to purchase a Medigap plan or if you want to go with a Medicare Advantage plan. So I offer all of those options. It really just comes down to personal preference. In New York State, we happen to live in a state where you can purchase a supplement even if you are not well. And so why I bring that up is if you live in a state other than New York, it's very likely that you have to prove insurability, which means you have to be healthy when you purchase a plan. In New York State, that's not the case. You can have a cancer diagnosis or something very serious, and you can still sign up for a Medigap plan anytime throughout the year. So that's why usually I steer my clients to taking a Medicare Advantage plan, because in most cases, you get very, very good coverage for $0 additional dollars. And it also includes dental and vision, which supplement plans do not cover. So if you want to talk a little bit more about that, we can talk privately about that. But I did want to give you the gist of it. When you take a Part C plan, okay, again, remember that's A, B, and D all under one roof. Some of them have a premium, but most of them don't. Okay. Some of them have a deductible, and that's something new this year, which we're going to get into. All of them have some kind of copay that you have to pay. And then sometimes there's coinsurance, and we'll get into that. Now, your premium, those of you who already have Medicare, you've been paying $185 a month to the federal government for your Part B, like boy. That's actually going to be going up to somewhere around $206 next year. So that's very, very important to put into your budget. Okay, is that you're going to want to set aside, it'll be $206 next year, likely. I'm 99% sure. They come out with the final number later. And then sometimes you have to pay a deductible depending on which plan you take. And without going into every detail, because I'd rather have a one-on-one with you so I can speak your language and be very, very specific to you, a deductible is something that you have to pay out of pocket before your insurance kicks in. Whether it's a prescription drug deductible or a medical deductible, you have to pay that first before you can use the insurance. So that's what that deductible means. A copay is something that you would pay. For example, if you had to go see a specialist, when you have a Part C, you have a copay to see a specialist. So the company, whichever company you pick, will pay most of it, at least 80%, probably more. And then you pay a copay of anywhere from $20 all the way up to $60, depending on which plan you have. Now, coinsurance is something that's always been around, but this is big for 2026 because most times prescription drugs were just using copays, where you would pay a flat copay of, let's say, $47 if you had Eliquis, for example. Now, most insurance companies have switched to a co-insurance. And so what that means is instead of paying a $47 copay for Eliquis, now you're responsible for 20% of the entire cost of that prescription drug. So that is a really big deal and a really big change for 2026. Now, one of the benefits of living in New York State, and some of our tax money coming back to us, is if you're over the age of 65 and you make less than $75,000 a year, you're able to get something called Epic. And Epic will help you cover some of that coinsurance that you have to pay. If you are married and you earn less than $100,000 a year, you also can qualify for Epic, which in most cases is free for most people. So there's no additional cost to have Epic. But Epic is New York State working with Medicare, which is the federal government, to control the cost of your prescription drugs. The good news is in 2026, the most that any senior citizen is going to pay is $2,100 for their prescription drugs for the entire year. So no one in America is going to pay more than $175 a month for their prescription drugs, which is great. Now, you can change your insurance as many times as you'd like from October 15th until December 7th. So you can shop around. Even if you've already made a decision, that's totally okay. You can still change your carrier. I'm not suggesting you do, but talking with a broker is important because my loyalty is to you as a client. I have no loyalty to a company. So I'm always looking out for your best interest. Not to say there's anything wrong with salespeople. I started off as a captive agent in sales, and I did do my best, but you are limited. If you go to independent health, for example, independent health is never going to say, you know what? I really think that Univera is a better option for you this year. Independent health is going to say, we have 8 plans. Which one would you like? So it does matter who you talk to and who you get your information from. I do also want to say, if you have independent health or BlueCross BlueShield, a big change for 2026 locally is they are no longer in network with Roswell. That is a really big deal. So another really big deal about independent health and BlueCross BlueShield members is that their plans are being dropped. So many of you, millions of you, have gotten letters stating that your plan no longer exists in 2026. Now, sometimes there's years where you don't even have to do anything. Your insurance will just roll over. And if you don't make a choice during this time frame, which is called AEP, it's okay because your insurance will just roll over. This is not one of those years. Okay, you are definitely going to want to talk to someone this year, hands down, and you're going to want to talk to a broker, whether it's me or someone else. Of course, I'm partial because I know I'm going to give you the right advice. And I mean, I will tell you not to become my client. I'm very honest about that. But you are going to want to talk to someone, especially if you have Highmark or BlueCross BlueShield or independent health. Also, if you're a veteran or if you know a veteran, please have them reach out to me. And the reason for that is because I have special plans with Humana. I've gotten special training on veterans and their families. So people who have CHAMP VA, VA benefits, TRICARE for life. And so there's special benefits that I can get you that you may not be aware of that are no cost to you, which is great. So how do you choose which one? Well, there's no such thing as the best company. I wish I could come on here, Al, and say, hey, this is the best company for this year. Let's do it. It just is not the case because there's so many different factors. Your health is a factor. How often do you go to the doctor? What health conditions do you have? What medications do you take? And then there's your budget. Would you rather be someone like my husband and pay a high monthly premium, but then not have to pay for anything throughout the year for the most part? Or would you rather be budget conscious and, pick something that's a little bit more friendly to your pocketbook? And then there's also your preferences. I have a lot of clients that are snowbirds. They live half the year here, half the year in Florida. You can't really have an independent health or a Blue Cross Blue Shield if you do that. Or I have clients who are veterans, right? That also changes things. There's special plans for people who are families of veterans. If you have Champ VA or TRICARE for Life. So, and there's so many other options. Do you have coverage through your employer or through a retirement plan? So sitting down with a broker is very beneficial because I will personalize everything to you. It's you get all these telemarketing calls. It's like the boogeyman, calling you every single day, like, you should be scared of this. And did you know you could get $1 billion in groceries this year? It's unbelievable. It's harassing. Every other commercial on TV, it's really crazy. So just know some of that stuff you hear is true, but a lot of times they market to Buffalo plans that really are only good in New York City. So you'll hear these grandiose numbers, and it's just not true here in Buffalo. Also, too, it's only for a niche market, like you have to be a veteran or you have to have Medicaid. So you can't believe everything you hear. That again, that's why it comes down to talking to someone who has your best interests and is not going to sell your number to anyone, is going to keep your privacy and be confidential. It's really important. So,
Before you go on, there was a question in there
okay.
about the penalty that you mentioned, and they
Yes,
asked if covered by an employer, which the answer is if you're covered by your employer, those penalties don't apply. It's when you don't have any qualified health insurance and you don't take Medicare, that's when the penalties apply, correct?
that's right.
And lastly, on the prescription drug, with all the changes on prescription drugs, so there's no more donut hole that people were used to before, right? So if I am paying, let's say 20%, my prescription is $500, I'm paying $100. Once I get up to 2100, I don't pay that $100 anymore, correct?
That's right.
Okay, so then that co-insurance stops at the catastrophic limit.
Correct.
Okay.
Something else important to know, Al, is, and that all sounds great for people who've been paying a lot of money, but there's some people out there who have been paying $0 copay for their prescriptions, and they're going to get a surprise in January because they're no longer paying $0. A lot of these companies have a prescription drug deductible, even up to $615, where something that they have made maybe have paying $0 before, now in January they're going to have to meet a $615 deductible. And the reason for that is they're trying to even out the market because there were some seniors who were paying thousands of dollars a month. You hear those horror stories about how they can't pay their bills and they're eating cat
Mhm.
food, right? But then the pendulum is swinging now this direction. So people who were used to paying zero are now going to be paying more in a lot of cases.
So just because a drug is a certain tier with one company, does that mean they're the same tier with another company?
No, no, that's a very good point to bring up. The tiers change from company to company, and it really does matter. Again, going back to a broker, that's why you want to talk to a broker because, it's not even just the tiers of the prescriptions. It's also, are your doctors in network? What hospitals do you want to be able to go to? So there's a lot of factors within the companies. Do you need national coverage or is local coverage okay? Those kinds of things.
So on drug coverages, they separate out tier one, two, three, four. I don't know if they go up to five. Who
Goes
knows?
up to
There's
six now. Tier
oh,
six for
six.
some
Okay.
places. Yeah.
Just keep adding to it, just like the alphabet soup. We'll just keep adding numbers as we go along here, huh? But for like the health plan, it's generally a tier A or B or in network, out of network, or is there an overlap there for the plans?
So that's actually a really good point to bring up too. And I dealt with that today with someone is sometimes prescriptions are in the formulary with some companies and they're not even in the formulary with other companies. So that's important to know too. They could be a tier 4 with one company and not even be a part of the formulary in another company. So yes, there it is really important to get that one-on-one time so you can have somebody evaluate that for you.
And sorry to spend so much time on prescription drugs, but I think a lot of people are on some kind of prescription drug before they're
Yep.
actually hospitalized or something like that,
Right.
as a way to treat. But on a prescription drug front, if um, is it advantageous for people to contact their physician to say, "Hey, I'm on this drug. Is there a generic drug that might be a different tier that might be cheaper?" To consider versus just keep taking the same thing that you've taken for the last couple of years? Are people consulting doctors on options as well?
Yes, and it also works the other way too, Al. So if you want to save money and take something generic, you absolutely have the right to talk to your doctor about that. But also, it works the other direction. So my mom has epilepsy, and she was taking a drug called Keppra. And they did come out with a generic version of that, and she wasn't having seizures for years. And then they put her on the generic version, and she started having seizures. So I say that not to scare you because I think generics are an amazing option, and most of the time it works. But sometimes the carrier will try to force you to take the generic, and you do have the right to have your doctor say, I don't want the generic version of this drug, and this is why. So it works both ways.
Well, that makes sense.
Mm-hmm. Any other questions?
No, not yet. Not on prescription drugs.
Okay, great. Yeah, if you don't have Epic, I strongly, strongly recommend Epic. So I just want to talk about how to. So if you know anyone who's new to Medicare, they don't have Medicare yet. You don't call Medicare to sign up, which sounds ridiculous, but you actually have to call Social Security. And you can't just walk into an office either. You have to schedule a specific appointment with a specialized agent to do that. So please, if you know anyone turning 65, please remember me. I've been doing this specialty for over a decade, and I still handle my clients personally. I would love to help them through this process. So that's why you may wonder why is Social Security up there. That's why to sign up for Medicare, you actually have to call Social Security. So thank you so much for listening. I would like to go over a couple of specialized things for our area and then open it up for questions.
Sure.
So, some of you who have United Healthcare may have gotten a letter stating that they are no longer going to be in network with Kaleida, Buffalo General. I just want you to know, as of 2 weeks ago, that contract has been signed. So if you have United Healthcare, you do not have to worry. They are in network with Buffalo General and Kaleida. So that's really important. So those of you who have employer coverage, it's very important for you to know, as much as I would love your business, you should not do business with me. And if anyone else tells you differently, they're full of it. Do not change your insurance. There's different rules when you have employer coverage. And the only time that you should consider changing that employer coverage is when you're in your 90s, maybe late 80s, and if you decide to go on Medicaid, which a lot of people think is for low income people, and that's actually not the case. If you once you become disabled, which I don't know many people in their late 80s working full time or that can work full time, so that's when you still qualify for Medicaid, and it doesn't matter how much you have in your 401k or your IRA. Once you're drawing from that, Medicaid actually takes a look at that as it goes from an asset to an income. That's a whole other conversation, but I digress. My point is this: if you have an employer coverage, the only time you should switch that plan, there's two times. If within your employer, okay? So if your employer is saying we're having a meeting and where you can switch your plan, that's fine with your employer, or if you get Medicaid. There's literally no other time you should be wasting your breath listening, your brain span listening to anyone else because they're just trying to make a sale. Do not change your insurance. The last thing I'll say on a local level is, going around to all these different plans. There's nothing wrong with that. Okay. But I will tell you that when you walk into Univera, they're going to talk to you about Univera. When you walk into Highmark, they're going to talk to you about Highmark. When you go to Independent Health, they're going to talk to you. So it really does make sense, whether it's me or another broker, you want to go to someone who is fully licensed with most of the major carriers and let them be very honest with you, because it's not that these people are lying to you. They're just either withholding information or they genuinely don't know. And so you really want, instead of you taking your time going to all these places, you can talk to a broker who could look up all of this stuff for you. It would take them half an hour, something that would take you probably 5 to 10 hours to do. So I can't stress that enough.
Speaking on the local front, are we've talked about independent health and Blue Cross and Blue Shield. Is Univera still in network with Roswell, for an example?
Yes, Univera is actually an excellent option for 2016 for a lot of people. I'm not going to say it's the best plan. It's not the plan my husband has. So, and I love my husband, right? And it's not that Univera for most people is an excellent option. For those of you who don't really, care about going to Roswell, if that's not a big deal to you, there are some other options that I think can fit better depending on your needs, right? So again, my husband is much more conservative than me. He's much more aware of he likes stability. He likes comfort. He likes credibility. I'm more, fly by the seat of my pants with, knowledge, but I'd rather save the money. So, everybody's different, and I tailor it to you personally.
So with independent health, I'll pick on them for a second because they,
Yeah.
for anyone that doesn't know, they were fined by the Center for Medicare and Medicaid
Right.
$98 million last year.
Yeah.
Um, so if I want to stay with independent health and God forbid I need some cancer treatment at Roswell, they'll still cover me as an out of pocket, but I'm still subject to up to 50% as a deductible, and then plus up to the maximum out of pocket cost. So once I get up to that, a cancer surgery, I can't imagine what that would cost, but I'm
Yeah.
sure if I had that out of pocket cost of 13,000 or whatever their out of network maximum is, that those bills would stop after that, or pretty
That's
much
right.
stop.
Yes. Yeah.
So I think people are just a little, it is a big deal for a lot of people, but there is some coverage if you do have one of those plans. I think people were a little scared at the beginning, like, oh my God, and all my coverage is gone. It's not all of it. It's
Right.
just you're going to have to pay more.
Right. Exactly. So it's good to get educated. I'm a teacher at heart. I always will be. Since I was 3, I knew that's what I wanted to do, and that's what I do, is educate. And there's nothing wrong with, getting the information and educating yourself. So yes, but for those of you who are losing your plans, just be sure, especially, that you do, shop around and make sure. And you do have, I will say this, you have until the end of December. So if you have independent health or Blue Cross Blue Shield and you're one of those people who are losing your plan, you have a little bit of extra time. So you have until December 31st, and everyone else, you have until December 7th.
Now, can you just touch on another benefit of Epic of changing plans throughout the year?
Yes, actually, you beat me to it. So
Oh, okay.
whatever you decide to choose by December 7th, they will send you a card in the mail, and it will start January 1st. Then there's a special election period. Then there's an election period called OEP, and that's called open enrollment period. And so anyone that has a Medicare Advantage plan, which is Part C, you have from January until the end of March to be able to choose another plan. Now, if you're a higher income person and your income is over 100,000 a year, this is your only opportunity to make another change. Okay. Come April 1st, if you're higher income, you cannot make another change. If you do have Epic and you're single and you make under 75,000, or you're married and make under 100,000, you have from April to December to change your mind again. And you can change your plan one more time. So, Epic is a great tool. I joke with my clients, I call that your get out of Medicare free card. So you can change your Medicare plan at any time using, if you have Epic.
Perfect. Also in the notes here, I put a link to the New York State Health Epic website, and also a link to the Center for Medicaid and Medicare .gov website as well.
That's great. Yeah, I can email you a paper application if people prefer to print it. I have the updated one, and I'm happy to send that when we're done here.
Perfect. Do you have any more? Do you want to open it up for questions or?
Sure. Yes, let's open it up for questions.
Okay, we'll open up for questions, but before we do so, try to keep any specific personal information to yourself, because like I said, this is going to be broadcast through other clients and on our YouTube channel. So, but if you have any questions that you want to ask, you're more than welcome to open it up, or asking that if you can't get on camera or don't want to get on camera and just want to type it in the message, I'll certainly read those off and we'll answer those questions.
I have a question.
Okay.
So I'm going to be probably moving next year. So if I signed up for a Medicare Advantage program in 26 before that April deadline, can I change that to a Medigap product, or do I have to choose a Medigap program from the start?
That's a great question. So as long as you have insurance of some kind in place, you can choose a Medigap plan at any time. There's no election period for that.
Okay, that's good to know.
Mm-hmm. And I saw someone ask how you can schedule an appointment. So
yeah, me too.
Yes, first of all, thank you. I would be honored to do some research for you, and you can call or text me. Again, my name is Laura Shriver Brown, but I usually have people save me and their contacts as Laura, the insurance lady, or Laura, the Medicare lady. So a couple years down the road, you're not like, who's Laura? So Laura, the Medicare lady. And my phone number is 716-228-4482. And I'm also putting that in the chat. You can text or call me. So this has been the most grueling open annual enrollment period I have ever had. When I say I'm working 7 days a week, I'm working 7 days a week. I work 10-hour days on the weekend and 14-hour days during the week. This season is absolutely insane. So it's better to text me, because I'm likely, with a client. But if you can't text, of course you can call me, but it takes me longer to get back to you when you call.
So I do have another question. Are carriers getting rid of some of their extra benefits? I think BlueCross BlueShield was silver sneakers, and I don't know, are organizations or carriers getting rid of some of that stuff? Or
yes.
Okay.
Yes, a lot of them have changed. Well, what happened is, on the federal level, in their defense, on the federal level, they're getting less reimbursement. Okay.
Right.
So a lot of them are scrambling to find. So Independent Health got rid of their over-the-counter benefits, for example. A lot of them have added a medical deductible, which is really going to surprise a lot of people, because they're not even paying attention to it. They're going to Highmark, Blue Cross, they're going into the independent health office, and they're like, okay, I'll choose that one. Well, I'm paying $95 a month. That must be good. Well, On top of your premium, you also have $150 deductible that you have to pay before you use most of the coverage. So you have to be careful. Not only did it take things away, but they added things people aren't used to, and they're kind of overlooking it. And they're going to be surprised, sometime in June, when they go get a CAT scan or something and they have this extra $150. They're like, why am I paying that? So yes, they have taken things away, and also they have added things that people just aren't used to. So having a personal conversation really matters.
What about dental coverage? Is dental coverage included in any of the plans?
Almost every plan has dental coverage.
Okay.
Veterans get something very special that it makes me so happy to do this for them, because the VA oftentimes does not provide dental. So when it comes to my veterans, there's a $0 plan I can give them that gives them dental. It actually pays a lot of their Part B. It can pay up to $115 of their Part B premium, which comes out to be like $1,400 a year in their pocket, which is really cool. If you're not a veteran, most plans come with at least x-rays and cleanings. Aetna in particular has a plan that's all it comes with. But then Aetna has a really great plan where you pay $27 and you get $2,000 in coverage and all this other stuff. Yeah, every company and every plan is different. And I kind of like to use the example of people, right? So I'm not everybody's cup of tea, and that's okay, right? And there's a lot of good things about me, and then I have some flaws, right? Just like everyone. And it's the same with companies. They have things that they're very, very good at and well known for, and then things they're not so good at. So when you're picking a company and you're picking a plan within that company, it's very important for me to know what is it that is important to you. So when we talk, I find that information out, and then I can put, because some people don't use dental. So maybe you want that Aetna plan because now you're going to have lower copays so everybody is different. For somebody who wants really well-rounded coverage and be able to travel the country, United Healthcare is a great option. So, and they have great dental too. So every company is different, and also depends on your dentist. Sometimes they might need a plan where they could pay out of pocket because the dentist doesn't take any Medicare insurance. So it really depends.
That was going to be my next question is, are you finding that there are a lot of dentists or dental practices that don't accept the Medicare coverage? Are you hearing that from your clients?
Yes. So
yeah,
that's where, picking the right plan where they can still bill the company, and maybe get out of network or pay up front, and then the Medicare company will reimburse them. Sometimes you can purchase additional dental, which I do sell, but I don't sell it very often because usually I can find you something for $0 that fits your budget. I think in my whole career I've sold 2 dental plans. But I do have the ability to do that, but it's very rare that I do.
Thank you.
You're welcome.
Does anyone else have any questions? Well, Laura put her contact info in the chat. And again, I want to thank you very much for the short notice as helping us out to even in this crazy time period of Medicare changes. And it seems like this year is, different than any other year when it comes to Medicare. And, God only knows what might happen next year, but certainly, I just want to thank you again for your time, taking out of your busy schedule and helping us out today.
You're welcome.
And finally, like I said, her info's in the text. You can always reach out to one of your advisors, and we can get you in touch with Laura as well. So thank you very much. I appreciate your help, and everyone have a good night.